Are you going through the process of your initial enrollment into Medicare? If that's the case, this video is dedicated to you, and I will do my very best to share as much information as I possibly can, but at the same time, I certainly do not want to overwhelm you, as I totally understand this can be a very confusing process with a lot of questions. So this is likely going to be part one of a multi-part series that I produce for you here on the channel in this process of applying for and getting Medicare, as well as getting a Medicare supplement, Medicare Advantage, Medicare Part D, whatever else you need. There's a lot of moving parts here. So with that being said, let's jump into the details. Now, first off, let me share with you some quick statistics about this, because this is wild, okay? As of right now, there's about 70 million people that are either enrolled in or currently eligible for Medicare right now. Get this, nearly 12,000 people are also becoming eligible for Medicare every single day. Not every single week, not every single month, literally every single day. That is a huge number of people, and you can imagine there's a lot of people that are in the same position. Now, to put this into context, just a handful of months ago, I helped my parents go through this exact same process, and honestly, it was a little bit of a nightmare. They had a million questions. Every time I saw my parents, my dad had his whole list written up. Hey, Matt, I got a bunch of questions on Medicare. You mind spending an hour talking about this? I mean, literally, they were going to seminars and classes, calling me, texting me. We were talking about this all the time. That was just for the initial enrollment into Medicare. And then the supplement on top of that, oh yeah, a whole nother pile of questions. So if that's your situation, please do not feel overwhelmed. This is the case for the vast majority of people. It's okay, I want to do what I can for you to provide as much value, talk you through the process, and like I said, I will make multiple videos about this, again, kind of easing into this, because I get it. It's not one thing we can cover in one video. There's a lot to it, okay? Which, by the way, you see that phone number hanging out on your screen right there? After going through the process of helping my parents with their initial enrollment into Medicare, it was a nightmare, honestly. I thought, you know what? I need to partner with somebody, a reliable source here. And again, that's why I created this partnership with Chapter. And again, they are the leading brokerage across the entire United States with this. I mean, seriously, they're doing amazing things for those of you here in this community. But anyway, they're waiting on standby to talk to you right now, and they will help you through this process with finding a supplement plan, a Medicare Advantage plan, Medicare Part D, whatever it happens to be. They will sift through the 24,000+ plans across the country, find the plans in your local area, isolate those down to your personal needs, your personal preferences, the prescription needs you have, if you have any, dental needs you have, if you have any, what providers you want to see, the doctors, the networks, all of it. They'll do all of the grunt work. Guess for how much? Free. Yeah, exactly, free. They'll present you your options, the best plan with the best coverages, with the best price in your local area, and at the end of the day, it's up to you to decide if you want to move forward or not. And again, they do all of that 100% for free consult. It's amazing. Again, well, I'll be honest with you, when I was doing this with my parents, we tried to hack it out ourselves. Bad idea, really bad idea to try to hack it out yourself, okay? We did that with my parents. We got them on the wrong plan. Didn't know that until it was too late. And now they're stuck, okay? So anyway, sorry, Mom and Dad. We'll get you figured out here, next time around. But anyway, feel free to give them a call. Again, my guys over at Chapter, they're doing amazing things for those of you here in the community. You got the phone number there on your screen. Feel free to give them a call now. Otherwise, take a screenshot of this and come back and give that phone number a call. Otherwise, down below in the description at the top of the comments section is the phone number and a link to their website there. Again, they'll give you that free consult. Amazing stuff. They're helping hundreds and hundreds and hundreds of you here in the community that have already connected with them. So amazing. It's awesome, okay? Anyway, I just want to do what I can to help you through this. That's one way you can take a huge burden off your shoulders and a lot of confusion with the whole supplement and Advantage and Part D situation with that. Let them do the grunt work. Seriously, let them help advise you on that. That's really cool, okay? All right, so that alone, take note of that phone number there. Again, take a screenshot, whatever, give them a call. You'll be super happy you did. All right, so here's a couple things. And again, some of this may seem super obvious. Again, let me start out with the obvious, easy stuff here. And again, we will, progress here with future videos. So here's what else you need to know. You have a 7-month initial enrollment period, okay? So it's called the IEP. It's the initial enrollment period. It's a 7-month window around your 65th birthday, okay? By the way, I've seen a bunch of information out there like giving different ages in which you can be eligible for Medicare. No, it's 65, okay? Social Security is 62, 65 for Medicare, okay? You got a 7-month window. The 3 months before your 65th birthday, you have this period of time where you can shop and basically enroll in plans, okay? More on that in a second. You've got the month of your 65th birthday, and then you've got 3 months after your 65th birthday. Those 7 months are the initial enrollment period where you have open to you to shop and enroll in plans, okay? Now, you might be wondering, hey, but I turned 65, in X month, whatever. I'm shopping for my plan in the 3 months before. I'm going to enroll in a plan in those 3 months before. Great, that's okay, you can. But when does it go into effect? Right away? No, it doesn't, okay? It goes into effect the first of the month of your birth month, okay? So let's just say that you turn 65 in July, for example, okay? I'm just making up a month here for easy purposes. You turn 65 in July, and again, it could be any month, whatever, but let's just say that you enroll in a plan, 2 months before that during your IEP, initial enrollment period. Does it go into effect immediately? No, it goes into effect the first day of the month of your 61st birthday. So in this case, it would be July 1st, would be the month in which you turn 65. Your plan would then go into effect July 1st. Is that going to make sense? Right? So there you go. That's what you need to know about it. Now, let's just say that you enroll in a plan in the 3 months after your 65th birthday. You still have that open to you. When would it go into effect then? Since you would already be 65 at that point, it would go into effect the first day of the following month. For example, you turn 65 in July, you decide to enroll in a plan in August. Guess what? It goes into effect September 1st, okay? The first day of the month, the following month. Make sense there? Okay? And again, I know some of this seems obvious. I know some of this is basic, but again, we've got to work our way up to the more complicated stuff, because if I start with that, we're going to be way too confused and lost, and that's not where we want to start this process, okay? Anyway, where can you apply for Medicare? Well, right on the Social Security website, okay? You can go to the Social Security website. You can apply for Medicare there, and again, it's the process there. Now, can I give you personalized advice right here in this video? I'm going to say this much. No. Reason being is everybody's situation is going to be very different, but it is a pretty intuitive process of going through the Medicare application and applying for Medicare. You can do it right on the Social Security website, okay? So the best thing I could say, go to ssa.gov, the Social Security website. Make sure it's .gov. That's the real authentic website for Social Security, and you can apply for Medicare right there, okay? Now, if you are currently receiving, if you're currently receiving Social Security, if you do enroll in Medicare Part B, the Medicare Part B premium right now for 2025 is $185 a month, okay? You can forego enrolling in Medicare Part B, okay? B as in Bravo. You can forego that, but just remember this much. If you do forego that, you will be subject to a penalty the longer that you forego that, okay? So what I'm saying is you probably don't want to forego that. You probably don't want to do that. If you're going to go down the Medicare Part B route, okay, the other option would be is Medicare Advantage, okay? I don't want to lose anybody here. I don't want to get this to be too complicated, but we'll come back to that, okay? But anyway, if you're already receiving Social Security, so if you're already getting your Social Security benefit, you would have your Medicare Part B, if you do enroll in that, the Medicare Part B premium of $185 will be automatically deducted out of your Social Security benefit check, okay? So before you see your check every single month, they will take the premium out of that. $185 is what it is right now for 2025, okay? But if you are not currently receiving Social Security, if you enroll in Medicare and you do opt in to the Medicare Part B option, okay, if you do decide to do that, you would then need to pay the premium on your own, okay? So you would have to cut a check to them. You would have to get a direct withdrawal, whatever, out of your bank account each month. You would have to set that up and pay your premiums on a monthly basis, okay, for the Part B. Again, $185, okay? Please don't miss that. Just want to make that very clear, okay? So you do not need to be receiving Social Security in order to be enrolled in Medicare, okay? You don't have to. You can enroll in Medicare and wait on your Social Security. If you're already receiving Social Security, you know the drill. I just said it there. Which, by the way, quick side note, I have thousands of videos here on the channel about Social Security. I literally talk about Social Security every single day in my videos. So if you're on that, fence too, and you're, thinking about enrolling or claiming your benefit, feel free to watch the videos here on the channel and subscribe as well. I have thousands of videos here in the video library on Social Security, and I'm literally talking about it every single day, okay? There's a lot to go on. All right, so here's another couple things you want to know about this. And again, this may seem obvious, but let me point it out. Medicare Part A. You get this automatically. It is the hospitalization, okay? Many people refer to it as Medicare Part A is the hospitalization or the hospital coverage. True, that is what it is. You get that automatically. Part B is optional. You do not need to take Part B, B as in Bravo. It is optional. You can take it if you want to. You don't have to, okay? This is what people refer to as the doctor coverage, right? You hear people say that. This is the doctor coverage. That's what it is, Part B, okay? Now, Medicare Part C, C as in Charlie. This is otherwise known as Medicare Advantage. More on that in a second, okay? Medicare Advantage is called Medicare Part C. Now, Medicare Part D, D as in dog, okay, dog, okay, Medicare Part D is the prescription coverages. Not everybody needs this. This is also an opt-in. You do not have to take Part D. It's an opt-in, okay? Got to pay for it. There's a premium associated a lot of times. There may be zero premium plans, but again, just want to let you know that, okay? Which, by the way, any supplement plan, any Medicare Advantage plan, any Part D plan, things like this, again, my guys over at Chapter, the phone number you see there on your screen, they can help you out with that. Amazing people over there. They're helping so many of you here in this community. Phone number right there on your screen. Take a screenshot. Give them a call. You'll be super happy. They will do all the grunt work for you. They will help you out with all this confusing information. I know. We're not even into the heavy stuff yet. I mean, this is still pretty basic, okay? All right, let's quickly talk about Medicare Advantage, okay? I alluded to this a second ago. Medicare Part C, okay? This is Medicare Advantage. Now, you have a couple options. You can take traditional Medicare, which would include Medicare Part A, Medicare Part B. These things, this is traditional Medicare. The other option would be Medicare Advantage, okay? You got traditional Medicare and Medicare Advantage, which, by the way, it's about a pretty even 50-50 split between the people that take traditional Medicare and Medicare Advantage, okay? There's actually a little bit more people that take Medicare Advantage, but it's pretty close to the 50-50 split. So you got to figure out what's best for you. But Medicare Advantage is a privately approved Medicare plan. What do I mean by that? It's basically a private insurer. Let me give you some examples. United Healthcare, Humana, whatever. You know the whole list, the big insurers that we all know about. But anyway, what they do is they put together a Medicare-approved plan, and they call it Medicare Advantage, okay? And then they offer it to the marketplace. So we have the option of coming in and taking traditional Medicare, Part A, Part B, through traditional, Medicare through CMS, Centers for Medicare and Medicaid Services, or we have the option to take Medicare Advantage, where we can go to one of these private providers, again, one of these big healthcare providers, and we can opt in to getting a Medicare Advantage plan. Now, what's the difference here? Generally, Medicare Advantage plans also have the hospitalization built in, the doctor visits built in, like the A and B built in. They also have a lot of times prescription coverages, as in the Part D built in. A lot of times they may have dental coverages built into them, okay? So that's what it is. Now, generally, these are more comprehensive plans. Not always, but a lot of times the Advantage is a lot more comprehensive, and it has all of the features within the A, B, and D built into them, okay? Not always. There's a ton of plans out there. As you heard me say before, there's over 24,000 plans across the country. Do you think that's going to be easy to navigate that? Not a chance. That's, again, why I partnered with the leaders in the country. Again, Chapter, my guys over there with the phone number on your screen. You'll be super happy you contacted them. Because can you see a little bit already how confusing this is? Yeah, it's confusing. There's a ton of options out there, and it's hard a lot of times to figure out the best options for us. And if we try to hack this out ourselves, by all means, you certainly can. But in my situation, I feel like, hey, if I have somebody doing all this grunt work for me for free and presenting my options, I don't know. To me, that sounds pretty appealing. I love the sound of that, right? Saves me a lot of time, a lot of frustration, and a lot of confusion when I'm trying to hack this out myself, or when my parents or somebody like that is trying to hack this out. Yeah, why not just have somebody do it who knows what they're doing and, can do all that for you? That's exactly what my guys over at Chapter are doing. So anyway, let's leave it at that for now. I don't want this video to get too long or too confusing. Stay tuned. I will continue to keep you posted with more progression on this. I will continue to move forward with this and bring you more and more, I want to say, confusing or complicated information, but we will continue to ease into this more and more in future videos. But let's leave this one where it is. Again, give my guys a call over at Chapter. Again, they will help you out with all of your supplement plans, your Advantage plans, your Part D coverages, whatever you need. Find you the best plan in your local area with the best coverages, the best networks, the best doctors, the best dental, the best prescription, the best price, the best copays, whatever you need for your personal preferences. They'll find it all for you, and they'll present your options totally for free. Amazing. Absolutely amazing, right? Anyway, like I said, phone number's there on your screen. Down below in the description or the top of the comment section, the phone number and a link to their website is there. Again, take a screenshot. Take a screenshot of the video now. You can come back and take a look at the picture so you can see the phone number there. Otherwise, let me ask a huge, huge favor of you. Who do you know? I know you know a few people, friends, family members, acquaintances, siblings that are going through the same thing right now. Please share this video with them. I know you can think of a handful of people. Just share this video with them. There's a share button down below. Feel free to share this video out to them. Otherwise, like I said, take that screenshot, take a screenshot and text this picture, this screenshot over to those people and just say, here, watch this video. Call the guys over there at Chapter to help you out with this. It'll be amazing. Again, you'll be the hero for your friends, family, social media, your siblings, people that are going through this as well. You'll be the hero to them. Thank you. I truly appreciate your support. I want to help you through this. I know it's massively confusing. Like I said, I went through this a handful of months ago with my parents. I can't even believe it. I mean, they were so confused, okay? It's okay. If you're in that position, it is okay. Please do not feel bad about it, okay? Anyway, please subscribe to the channel as well. 100% free to do so. Big subscribe button down below. Otherwise, check out the thousands of videos here on the channel in the video library. The popular videos, again, down below in the description. Otherwise, popping up on your screen now. Otherwise, thank you so much for allowing me to advocate and represent for you. Thank you so much for your continued trust in me and the content and these videos and everything I'm delivering to you every single day in these videos. I truly, truly do appreciate it. Otherwise, please have a nice day. That's all that matters right now. Enjoy. I'm here for you in any way that I possibly can be. Have a good one, and I look forward to seeing you again soon in the next video.